Former U.S. President Donald Trump has once again reignited controversy in the public health arena by linking childhood autism to the use of Tylenol during pregnancy and to vaccines given in early childhood. His remarks, delivered during a recent public appearance, immediately drew criticism from medical experts, scientists, and autism advocacy groups, who stressed that these claims are not supported by scientific evidence and risk causing real harm. Trump has previously courted the anti-vaccine movement, suggesting in the past that routine childhood immunizations may be connected to the rise in autism diagnoses. In his latest comments, he expanded those claims to include acetaminophen, the active ingredient in Tylenol, saying that pregnant women who use it may be contributing to autism in their children. While he couched his remarks in the language of questions worth asking, the message reinforced long-running conspiracy theories that have been repeatedly debunked. Scientific evidence says otherwise. According to the Centers for Disease Control and Prevention (CDC), the National Institutes of Health (NIH), and the World Health Organization (WHO), there is no credible evidence linking vaccines to autism. Extensive research over more than 2 decades, including studies involving millions of children, has concluded that vaccines are safe and do not cause autism spectrum disorder (ASD). The origins of the vaccine autism myth trace back to a discredited 1998 paper by Andrew Wakefield, which falsely claimed a connection between the MMR measles, mumps, rubella vaccine and autism. That paper was later retracted for serious ethical and methodological flaws, and Wakefield lost his medical license. Still, the misinformation spread rapidly and continues to fuel vaccine hesitancy today. As for Tylenol, some limited studies have examined possible correlations between prenatal acetaminophen exposure and developmental outcomes, but experts stress that these findings are inconclusive and do not demonstrate causation. The Food and Drug Administration (FDA) and professional medical associations advise that acetaminophen remains one of the safest pain relievers for pregnant women when used as directed. Suggesting a proven link to autism is considered irresponsible and misleading. Public health concerns. Medical experts warn that Trump's comments could have dangerous consequences. Linking autism to vaccines may discourage parents from vaccinating their children, potentially leading to outbreaks of preventable diseases like measles and whooping cough. The CDC has reported that measles cases in the U.S. have been on the rise in recent years, largely due to declining vaccination rates in some communities influenced by misinformation. Pregnant women may also become fearful of using safe medications, potentially leading to untreated pain or fever. Unmanaged fever during pregnancy, in fact, poses more established risks to fetal development than acetaminophen use. Reaction from experts and advocates. Dr. Peter Hotez, a vaccine scientist and outspoken advocate for science-based health policy, responded strongly, saying, "This is a reckless statement. There is no evidence that Tylenol or vaccines cause autism. Spreading these myths undermines public trust in life-saving medicine." Autism advocacy organizations also condemned Trump's remarks, arguing that they reinforce stigma and misconceptions about autism spectrum disorder. Many advocates emphasize that autism is a complex neurodevelopmental condition with strong genetic roots, not a disease caused by parental choices or medications. Political dimensions. Trump's comments appear to be part of a broader strategy to appeal to segments of the population skeptical of medical institutions and government health agencies. During the COVID-19 pandemic, his statements about alternative treatments and vaccine hesitancy played into similar themes. By casting doubt on established science, he may hope to energize a political base that distrusts experts and federal agencies. However, public health leaders caution that the politicization of medical science has real-world costs. As misinformation spreads, communities may experience declines in vaccine coverage, rising health disparities, and unnecessary fear among families. Conclusion: Donald Trump's renewed attempts to link autism to Tylenol and vaccines are not backed by scientific research and contradict decades of rigorous study. While his remarks may resonate with conspiracy-minded audiences, they risk undermining public confidence in safe medical practices and could contribute to preventable health crises. Experts continue to urge the public to rely on established evidence and medical guidance rather than political rhetoric when it comes to decisions about vaccines, pregnancy, and child health.